Okay, then it means I have chosen the right topic, right? Trust me on that. After this class, you would you would wish to God every day that you should have this task in your exam. I can guarantee you this. Sarcoidosis and pregnancy. It's a new talk, and as now college is very much keen to give you tasks from talk, so I would cover all new talks in my live free sessions, which has not come in exam so far, and they are very recent, say 22, 23, and 24. So I think that would be a help for everyone, because if it comes in exam, it will be easy for you, because it's really difficult to prepare all the talks. They are like releasing talk every now and then. Okay. So sarcoidosis, where it is. Here it is. First, it is going to be an introduction. It is going to be agenda and consent for asking questions. This everyone knows. Then HOPI. In HOPI, you will ask about pregnancy. Who will tell me what all questions you ask in pregnancy? Can you tell me more about your pregnancy? What is next question?
Whether it was a
Planned
spontaneous
or
plan.
planned or spontaneous? How is your
Any,
pregnancy
how
so
your
far?
pregnancy been so far? If it is a pregnancy of later weeks, if say 18, 20, 20 weeks, then ask this question. How your
Moments.
pregnancy been so far? But if patient has come with 6 weeks, 7 weeks pregnancy, this question doesn't sound very relevant. Rather than ask any complaints.
No, yeah,
Can you tell me about your pregnancy? Any complaints? Like sickness, vomiting, pain,
bleeding.
spotting from down below. If ultrasound report is given, no need to rule out ectopic pregnancy. But if ultrasound report is not given, then specially ask pain in tummy, any shoulder tip pain or fainting attack. If it is early 6-7 weeks pregnancy, it is a patient safety point. Now college gives many hidden agenda as well. Clear? Second question is obviously going to be about folic acid. Have you started folic acid, whether it was planned or unplanned? If unplanned, then which contraception? And always you will offer that we would put you in touch with contraception clinic. We will put you in touch with the contraception clinic. One need arises when patient has come with unplanned pregnancy. This is a patient safety point. If you do not offer effective contraception when needed, you will lose marks in patient safety, because patient has sarcoidosis and patient has come with unplanned pregnancy, which is not acceptable, because in sarcoidosis, we do give some biologics, we do give some immunosuppression, we do give some immunomodulator, which are not considered safe in pregnancy. Clear about this? This may sound very small point, okay, effective contraception, but see the depth of this question. Patient has come with pregnancy and she is on methotrexate. You getting my point? Now, and definitely whether it's her first pregnancy, that is again going to be very important. Now you'll ask about condition. What all question you are going to ask in condition one? Volunteer, please. Or I'll pick up.
Could you tell me about your disease? When was it diagnosed? And when did you see your specialist doctor last? And did you tell whether you are planning for pregnancy? Did you get green signal from your specialist? And any hospitalization earlier? What treatment have you been receiving for the same complaint? And have you noticed any new symptoms? And
very good. Again, I would suggest that you should go systematic way. Can you tell me more about your condition when it was diagnosed? That should be your first question. Second, any new symptoms lately? Rather than mentioning all the symptoms, In sarcoidosis, there are almost 20 symptoms. Any new symptoms lately? Because once you will speak about agenda, I have gone through your case notes. Please tell me how can I help you. She'll tell. I was having this problem and I was diagnosed as sarcoidosis patient. So here you will ask any new symptoms lately. Worsening of previous symptoms. Or how is control of condition. Any of one question you can ask. Any medications are you on? Any hospitalization? When met specialist and any recent tests? How are you coping? One volunteer read condition questions properly for me fast.
Tell me about your condition. When was it diagnosed? Any new symptoms lately? Worsening of previous symptoms. How is it controlled? How is the control of the condition? Any medications are you on? Any hospitalization? When met the specialist? Bar any recent test? How are you coping?
I clear about this. So anybody else wants to try this? Yes, ma'am, I can. Yeah, please.
So can you tell me more about your conditions?
Is it Shaista?
Yes, ma'am.
Shaista, can I see your lovely face once?
Not in such position.
It's
No.
okay, it's okay. You look beautiful, I know that.
No, ma'am. Just hold on, then it will take 1 minute, ma'am.
Okay, okay, go ahead with this. Then you prepare and come back. Okay.
Because I have to cover my head, that's why. Okay, ma'am.
Okay. Yeah, just tell about condition.
Dia GTM on. We spoke yesterday. Untuk di SCQID lah. Jadi list sini anak ni kan. Macam di SCQID.
So meanwhile, anybody will just revise what all question you need to ask in pregnancy? Anyone?
Ma'am, shall I?
Yeah, sure, sure. I want everybody to
Can you
participate.
can you tell me more about conditions? When was it diagnosed?
Aarti, Gayatri wants to say. Aarti, Gayatri wants to try.
Yeah.
She's not tried so far. Yeah, Gayatri, go ahead.
Can you tell me more about your condition? When was it diagnosed? Any new symptoms lately? Worsening of previous symptoms? How is the control of the condition? Any medications are you on? Any hospitalization? When did you meet your specialist last? Any recent tests? And how are you coping?
And what all question you are going to ask in pregnancy? She has come with 6 weeks pregnancy.
Um, uh, uh, was it a planned was it a planned pregnancy?
No.
No, sorry.
Any complaints?
Any complaints? Sorry. Yeah. Any complaints? Was it a planned or an unplanned pregnancy? And if was it natural, spontaneous, or not? And should I say this if unplanned for the contraception?
Then which contraception? That is again patient safety, no? In
All right.
complaints, you will ask complaints.
Or any nausea, vomiting, all this?
Sickness.
Should I specify?
Sickness. It's sickness. Right? Sickness.
All right.
Can't use jargons, no?
Any sickness?
Vomiting.
Sorry, ma'am. All right.
Sickness, vomiting, pain in tummy.
Vomiting,
Stay with
pain
me.
in your tummy,
Spotting down
below,
below. Any
pain in
any
tummy,
dizziness, fainting attack.
spotting down below. Fainting attacks, and ma'am, last one is
Shoulder tip pain. We have to rule out ectopic.
what was
We do not have any
shoulder
other,
tip pain?
right?
All right.
Whether it was planned or unplanned. Say,
All right.
say with me. Whether it's planned or unplanned.
Right.
Say with me, Gayatri.
Right. Whether it was planned or unplanned?
If unplanned, then if she says that it was unplanned, then which contraception were you using? If she says condom, first appreciate condom. Condom is a very good
I
method.
appreciate the fact that you are using condoms, but
because it prevents sexually shared infection. But it is not an
Infections.
effective contraception. Listen to me, how you'll discuss contraception. So, Sarah, was it a planned pregnancy? No, doctor, it was unplanned. May I know which contraception were you using? I was using condom. Sarah, condom is a very good method to prevent sexually shared infection, but I'm afraid it is not an effective contraception. It is not an effective contraception. So when need will arise, we'll put you in touch with contraception clinic for sale. Now repeat. Repeat.
Sarah, planned or an unplanned pregnancy?
It was unplanned, doctor.
All right. And what sort of contraception were you using?
I was using condom.
Sarah, I really appreciate the fact that you have been using condoms as it prevents you from any sexually shared infections. However, it is not 100% protective. If you want, then later on we will be putting you in touch with the with the
Contraception clinic.
sexual health clinic whenever the need.
Contraception clinic. Contraception clinic, beta.
We will put you in touch with the contraception clinic whenever the need arises.
Lovely. Now you will never forget this. Shaista?
Yes, ma'am. Good morning.
So nice to see you, huh? Lovely.
Thank you, ma'am.
Now tell me about condition.
Sarah, could you tell me more about your condition?
You
And all
just keep on saying.
Yeah. Could you tell me more about your condition? Are you on any treatment? And how are your symptoms now? Are you coping well? Okay. And did you meet with your specialist before embarking on pregnancy? Did you get the green signals regarding your pregnancy? Okay. Hence, these are the related to conditions. And for pregnancy, any complaints so far related to your pregnancy? Any bleeding, pain, or vomiting? Is this your planned pregnancy? Yes, just ma'am, something like that.
In condition, I'll repeat once. Listen to me carefully, everyone. Tell me more about. Always write more about. Why more about? Because probably she will give you some information while setting agenda. If you only say, tell me about your condition, she will again start from 1, 2, 3, 4, 5. But she has already said most of the things from 1 to 10 in the agenda, then say more about your condition. So probably now she will inform what she has not informed so far. Or if you think that she has already informed how she got diagnosed with this condition, just skip this question. Whatever is given in task, you have to skip that question. Whatever she has already informed, you have to skip that question. So if she has already informed about how she got diagnosis, how she got diagnosed in agenda itself, skip this question. Simply start. May I know more about your condition? Any new symptoms lately? Worsening of previous symptoms. Shaista, remember this sequence. You will not forget anything. Always start with new symptoms lately. Worsening of previous symptom or house control of your condition. Any medications are you on? Any hospitalization off late? Off late is very important because any patient who has been diagnosed with sarcoidosis, just say for like last 10 years. So if she got admitted at the time of diagnosis, it doesn't going to make any difference in your current situation or current treatment. So any hospitalization off late or lately. When met specialist or any recent test being done. If you say that I met this thing like 6 weeks back, did you discuss about your planning for pregnancy? How are you coping with it? Am I clear about these two things? Yes. Pregnancy and condition? Now next.
I'm sorry to interrupt. I have a question. Ma'am, actually, I am a bit confused regarding setting agenda. What it exactly? It's a silly question, but I don't know what.
It is not a silly question. It is a very important part of your task. After who is going to set agenda for Gayatri with introduction? A good volunteer who should not confuse Gayatri. Introduction and agenda set for Gayatri, please. Volunteer, please.
Ma'am, can I try?
Yes, I'll do. Okay.
Okay, who was the other one? Who was the other one? Okay, no. Shaista? Other one is not answering, so you can do that.
Yes, ma'am.
Gayatri, listen to her carefully.
Ma'am, only agenda, okay?
Introduction and agenda both.
Ma'am, agenda and introduction.
Yeah.
Hi, I'm Dr. Shaisa, one of the doctors in the antenatal clinic today. May I confirm your name and age, please?
Just move on.
Sarah. Her name is Sarah. So how would you like me to address you? Sarah is okay. Sarah, I have gathered from your case notes that your pregnancy test is positive and you have a condition called sarcoidosis, and you are here for further treatment options and your antenatal care. Am I right?
This is setting agenda. Setting agenda means what you are going to do in task in next 8-9 minutes. In next 8-9 minutes, you are going to address her agenda, and her agenda was that she is a case of sarcoidosis. She is pregnant. Now she has come here to understand her treatment plan. This is setting agenda. There are 2-3 ways of setting agenda. Either the way Shaista has done, she has read the task that you are pregnant, you are this and that, and you have come for the entry, the treatment plan. Am I right? Any specific concern? If you ask this one line, this will save your time, because any hidden agenda she will express here itself when you say any specific concern. Or if you want to make it easier, I have gone through your case notes, Sarah. Can you tell me how can I help you today? I have gone through your case notes, Sarah. Can you tell me what bring you here today? You set your agenda the way you feel more comfortable. This is what we call setting agenda. After setting agenda, you have to take consent for asking question. You cannot simply ask question directly. Introduction, agenda, then consent for asking question. How you are going to do that? I'll definitely address all your concerns, or we will make a safe and mutually agreed plan for your pregnancy. Before that, may I ask questions to know more about you? This is consent for asking questions. So before HOPI, it's introduction, it's setting agenda, and taking permission for asking questions. Is it clear to you now, Gayatri? Lovely. Now, I'll just give you brief idea about what all symptoms one can have in sarcoidosis. Tender bumps on upper part of body.
بس اكلت اللحمه وشربت
Everybody
دواء
mute yourself, please.
اكلت اللحمه بس ما بدنا في الليل ما بدك الليل
لا مش يعني مش قصدك حاجه رز طيب
Tender bumps on upper part of body or patches on skin, mainly on lower legs and arms. Maybe brown, red or purple color. Maybe brown, red or purple in color. So what symptoms? Tender bumps. Shortness of breath. Persistent dry cough. Tender swollen glands on face, neck, armpits or groin. That is lymphadenopathy. Painful joints, pain in bones. Red or sore eyes. Blocked or puffy nose. Irregular heartbeat. Tiredness and general feeling of being unwell. Headache. Kidney stones. Drooping of your face, eyesight or hearing problem, numbness, pins, needles in your face, difficulty in swallowing. This is because of facial nerve palsy or facial palsy. Now, who is going to repeat symptoms for me?
I'll repeat, ma'am.
I'll do that. Yeah.
Okay, it's Nagarathan. How do you pronounce your name, Nagarathan? I'm sorry because I always get confused. How to pronounce your name? Nagarathan.
Nagaratna, ma'am.
Nagaratnam. Okay. Nagaratnam,
Yes.
you want to read this for me?
Yes, ma'am.
Please go ahead.
Tender bumps on upper part of the body, patches on skin, lower legs and arms, brown, red, or purple, shortness of breath, persistent dry cough, tender swollen glands on face, neck, armpits, and or groin, painful joints and pain in bones, red or sore eyes, blocked or puffy nose, irregular heartbeat, tiredness and general feeling of well-being, being unwell, headache, kidney stones, drooping of the face, eyesight or hearing problems, numbness, pins and needles in your face, difficulty in swallowing.
Everybody will read this. Only then you will be able to remember. Gayatri, fast.
Tender bumps on upper part of the body or patches on skin, lower legs and arms, brown, red, or purple, shortness of breath, persistent dry cough, tender swollen glands on face, neck, armpits, or groin, then painful joints and pain in bones, red or sore eyes, blocked or puffy nose, irregular heartbeat, tiredness and general feeling of being unwell, headache, kidney stones, drooping of your face, eyesight or hearing problems, numbness, pins and needles in your face, difficulty in swallowing.
Divya,
Yes, ma'am.
read fast.
Yes. Tender bumps on upper part of the body or patches on skin, lower legs and arms, brown, red or purple.
Everybody memorize now itself.
Shortness of breath, persistent
Everybody
dry cough.
memorize now itself.
Shortness of breath, persistent dry cough, tender swollen glands on face, neck, armpits or groin, headaches, red eyes, and blocked nose, painful joints or painful bones, irregular heartbeat, tiredness and general feeling of being unwell, kidney stones, drooping of your face, eyesight or hearing problems, numbness, pins and needles in your face, difficulty in swallowing.
Dr. Geeta, would you like to read this?
Yes, doctor.
Please go ahead.
Yeah, tender bumps on upper part of the body or patches of the skin, lower legs and arms, brown and red spots of the purple, shortness of the breath, persistent dry cough, tender swollen glands on the face, neck, armpits or the groin. Yeah, next slide.
And no. At least you should remember 3, 4.
Yeah, there were numbness,
Pains, needles.
yeah.
And try to remember. Yes. Come on. What about pain in joints, bones?
Yeah, actually I was outside. Yeah.
Okay. So now go ahead. Read.
Okay. Painful joints and pain in the bones, red or sore eyes, blocked or puffy nose, irregular heartbeat, tiredness and general feeling of being unwell, headache, kidney stones, dropping of your face, eyesight or hearing problems, numbness, pins, needles in your face, difficulty in swallowing.
Anam, would you like to read? Aarti?
Tender bumps, painful joints, then red or purple skin patches, persistent dry cough, then tender swollen glands in the neck, face or armpits, then kidney stones.
Now next slide I will not show because Divya covered without seeing next slide. 4, 5 points. So now she has raised the bar. Come on, Aarti, come on, you can do it. You can do it.
What else, ma'am?
Okay, one more time. After that, I'm not going to show second slide. Fast. Read, Aarti. Aarti, read.
Okay, painful joints and pain in bones. Yeah. Painful joints and pain in bones, red or sore eyes, blocked or puffy nose, irregular heartbeat, tiredness and general feeling of being unwell, headache, kidney stones, drooping of your face, eyesight or hearing problems, numbness, pins and needles in your face, difficulty in swallowing.
Dr. Beena?
Yes, ma'am.
Please.
I have to read this.
Yes. These
Tender
these are the symptoms one can have in a if he or she is a patient of sarcoidosis.
So the symptoms could be tender bumps on upper part of the body or patches on the skin, lower legs and arms, brown, which are brown, red or purple. Shortness of breath, persistent dry cough, tender swollen glands on face, neck, armpits or groin.
What was the next slide?
Ma'am, I have just joined.
Okay,
Yes.
no, go through. Read. I've shown.
Painful joints and pain in bone, red and sore eye, blocked or puffy nose, irregular heartbeat, tiredness or general feeling of being unwell, headache, kidney stones, drooping of your face, eyesight or hearing, then problem, numbness, pins and needles in your face, difficulty in swallowing.
Dr. Banas. Dr. Banas, would you like to try once?
Yes. Yes.
Am I pronouncing your name correctly?
Yes, Banas.
Okay, Banas.
Yes.
You guys have lovely names.
Tender bumps. Sorry for the baby. Tender bumps on upper part of the body or patch on skin, brown, red, or purple, shortness of breath, persistent dry cough, tender swollen glands on face and neck, and armpit or groin, joint pain, tender joint. I can't remember the next slide, please. Can you?
What else?
Sorry for the
It's okay.
tender joint.
And it affects
tender
almost
joint.
every part of the body. So you remember, in eyes, what you
Yeah.
see in eyes?
Red eyes, red sore eyes.
Red sore eye.
and,
What you see in nose? What you see in nose?
Noise. Sorry.
Puffy, block noise, right? Nose, sorry. Puffy, block, nose. Then
Yes.
downwards is down. You remember, girls, you
irregular
remember that
heartbeat.
way. You remember that way. I think that it's becoming difficult for you to remember. So start the very first, that is bumps. Because that is the very basic thing that you find nodules all over the body. So that is going to be your very first symptom, tender bumps all over the part of the body and the skin patches. That is the first thing which you have to address. After that, start from the
Head.
top of your head. So first
Headache.
is headache. After that it is eyes.
Headache, eyes, nose.
After that it is nose. After
heart,
that it is your heart and lung. So heart.
Yeah, and heartbeat.
And what about lung?
Shortness of breath.
Okay.
Shortness of breath. Right.
Then it's armpit. And this thing. So you'll talk about?
Joints. Glands on face, neck, armpits.
Okay.
And pain in your joint and kidney stones.
Then you talk about
Yes.
kidney stones because kidney is down below. So kidney stones. Right? So you will never forget. And facial nerve palsy you can remember. So now is it easy to remember now? So now who wants to try without seeing the slide? Who wants to try? I'm just removing slide completely. Who is that brave volunteer who wants to try without seeing slide? And I don't want you to miss even a single. Shelly, Sarah, Simam. Simam, you wrote that you have read sarcoidosis, right?
No, ma'am. I was saying that you correct the right topic.
Okay.
Mhm.
Okay.
I didn't read that.
Okay.
But I can try.
Okay.
Yeah, I try. I can try
Okay,
this.
try.
These
Go ahead.
symptoms.
Go ahead. Yeah.
So tender bumps on the upper part of the body and patches on the legs and the arms. Then a breathing problem.
Color.
That may be red, brown, or purple.
Then start from head to toe. Then start from head and go head to toe.
So headache.
Yes.
Red eyes, puffy
Red
blocked nose.
Yes. Lovely.
And, drooping of the face, numbness or feeling of pins on the face. Then any breathing problem, persistent dry cough, irregular heartbeat.
Lovely.
The swollen glands on the armpits, neck, and the groin.
Lovely.
And the kidney stones.
Yes.
Joint pains.
Yes. Isn't it easy to remember? There's
Yeah,
always
it's
a formula
easy. Yeah.
Now who wants to try?
I will try, ma'am.
Divya?
Yes, ma'am.
We have already done, no? Let's other.
Okay.
Okay, Dr. Osman, Shelly, Sarah, Dr. May. If I'm pronouncing your name wrongly, please pardon me for that. Anyone who has not tried so far?
Yes, ma'am.
Yeah, Shelly, please go ahead. Please go ahead. Yeah.
Yes.
Yeah.
Yes. In the eye rays.
No. First, you tell about the skin. That bumps, because
okay.
that is the salient feature of that.
Okay. Regarding the skin, there is tender bumps or patches, it's brown or red or purple. There is in the eye, there is dry eye or dry eye or red. There is a shortness of breathing, persistent dry cough, chest pain, tender swollen glands in the armpit or in the face or in the neck. Also, there may be painful joints and pain in the joints. There is in the nose, there is black buffy nose, kidney stones, tender joints.
Okay. Anybody else wants to try? Then we'll move on. Anyone?
May I?
Yeah, sure. Veena?
Yes,
Can you
ma'am.
see your face, please?
From the symptoms of sarcoidosis starting
Veena,
from
can
head
you
to toe.
switch on your camera if you're comfortable?
Sure, ma'am.
Not comfortable? Okay.
I'm in the hospital right now. I have switched
You're
on my
looking
camera.
great. You're looking very nice. Yeah. Come on, shoot.
So starting from head to toe, the first is headache, drooping of the
No,
face.
first always it start with bumps, because that
Okay.
is the most important feature of sarcoidosis. Start with
Sure,
that
ma'am.
in the bumps.
Okay. The bumps over the body and
Maybe red, brown, or purple in color.
red, brown,
Tender
or
bumps,
papules are
upper
there.
part of the body, and skin patches. Okay.
Skin patches. Okay, ma'am.
Then start
Then
from.
okay. Then headache, drooping of face, puffiness of eyes, and this nose, blocked nose. Then this swellings in the armpit. Then tingling and this needles and pins on the face, and shortness of breath. Thereafter, difficulty in breathing, irregular heartbeat, kidney stones, joint pains. Yeah, remember this.
Not
one.
bad. Divya, now let's finish it off fast.
Yes, ma'am. So tender bumps on legs and arms, brown and black color, patches, and a headache, red or swollen eyes, puffy nose. Next, irregular heartbeat, shortness of breath, painful joints and painful bones, kidney stones, and next, that's it.
When you say shortness of breath, do say persistent.
Shortness of
okay. And painful, and then red and sore eyes.
Painful joints, painful bones, and swellings in the arm, face, neck, armpit, and groin.
Clear? Okay. Now next. After that, it is going to be routine information gathering. So we have done introduction, agenda, HOPI, in HOPI pregnancy and condition. And now you understood about the symptoms. So whatever symptoms she has, or if she asks like what particular symptoms you are talking about, so you can say like 2 or 3 lines about different symptoms which she has not had earlier. Then routine history. In routine history, you are going to ask everything, but these 3 points are very important. Family history. Anyone has same condition in family or partner is fit and fine. Then mental history again becomes very important. A patient who is coming with sarcoidosis, you will definitely say that I understand that you are going through a condition which is difficult to cope up with, but just to be precise, are you feeling low and depressed in past couple of weeks? This is going to be your mental history or a depression history in any patient who has come with a condition which is not easy to cope up with. Because in this patient, the task is that patient has come with this condition and patient is on some immunomodulator. So patient is having an active disease. So here you are going to take mental history the way I have told you. So that is something different and important. Then smoking. Smoking again very important because it deteriorates the condition. Rest it is going to be routine history. So these 3 are very important. After that, second part of the task, it is always a BBN. If it is an active condition, you will say I have to share lots of concerning information or I have lots of concern. Do you want someone to be with you? So here it is going to be a proper BBN.
Ma'am, why is it
Sorry? Then diagnosis. First, ask her understanding about condition. What all you know about sarcoidosis? Do you want me to explain this? Sorry? Is this somebody is asking something? How you are going to explain sarcoidosis? It is an autoimmune condition when our own immune system or defensive mechanism starts attacking its own tissue and organs, results in inflammation that causes tiny clusters of cells or tissue. We call it as granuloma in the organs. Or if you want to make it simpler, you can say tiny lumps at various sites within your body, most commonly affects lungs, then skin, heart, and nerves. Now, who wants to explain diagnosis? 4 volunteers. Fast, girls, we have to discuss a lot.
I'll explain.
Who wants to say diagnosis? Who wants to explain diagnosis? Dr. May? Doctor who has not listened so far. Anyone? It is written in front of you. You have to just read it.
I'll try, ma'am.
Yeah, please try.
Sarcoidosis is an autoimmune condition where our own immune system starts attacking its own tissues and organs, resulting in inflammation that causes tiny clusters of white cells or
White blood
tissues.
cells,
We
no,
call it
do
as
not mention white blood cells. I have just written it.
plus-
Whatever is given in this thing, that is for your understanding.
Okay. It forms tiny clusters of cells or tissue, and we call it as granulomas in medical terms, in the organs, and forms small lumps at various sites within our body, most commonly affecting the lungs, the skin, heart, and the nerves.
Okay, one more volunteer.
Can I, ma'am?
Yes, please.
Geeta here.
Yes, please.
Yeah. So sarcoidosis, it is an autoimmune condition. That means our body's protective system or defense system that starts to attack our own cells, our own tissues. That results in the inflammation and the formation of the lumps in different sites of our body, like lungs, then skin, heart, and nerves.
Lovely. Lovely. Anybody else? Last volunteer for diagnosis.
May I, ma'am?
Please. Yeah, go ahead.
Ma'am, Bina, may I?
Yeah, please.
It's an autoimmune condition when our own immune system start attacking its own tissue and organs, resulting in inflammation that causes tiny cluster of cells or tissues in the organs, or we can say that tiny lumps at various sites within our body, most commonly affects lung, then skin, heart, and then nerves.
So it's BBN diagnosis. First, you will check her understanding. If she wants to know more about this, then just in 2-3 lines. This is hardly 3 lines properly.
Okay.
You have to explain this. Okay. After that, definitely causative factor. What is causative factor? This is not known why immune system or defense mechanism behaves like this. Many people goes away without any treatment. However, in some people may become serious long-term condition requiring treatment. This is not known why immune system behaves like it, or you can simply say cause is not known. Many people go away without any treatment. That is almost 60%. 60% patients do not need any kind of treatment. However, in some patients, it may become serious long-term condition. Serious long-term condition which may require treatment. Though some infectious, environmental, or genetic factor may be responsible. can occur in other family members but not directly inherited. There is one more condition which we have discussed in previous session, which is not directly inherited. What was that?
Multiple sclerosis.
Lovely. You remember because I correct you, right? Okay, good.
Yes, I corrected you.
Sometimes making mistakes are good.
Yes.
Not infectious, cannot be passed from one person to person. More common in women, again like multiple sclerosis. More severe in Black and African origin. Any age, but more commonly between 20 to 40 years of age. So this is how you are going to explain. Now, who is going to explain from diagnosis till here in a very organized and a systematic way? If you want to go through, read it. I'll ask again after 30 seconds for volunteers. Time starts now. Who wants to present this?
I'll try.
Yeah, please.
From explanation, ma'am.
Yes.
Yeah, so it is an autoimmune condition when our own immune system starts attacking its own tissues and organs, which results in inflammation that causes tiny cells or tissues in the organs, or can say tiny lumps at various sites within your body. Most commonly, it affects
Any
the
of these two
lungs,
lines. This is,
skin,
I have
heart,
given two ways to
and
make whatever you
then
are
nerves.
comfortable with. Say any of these two. These two are the same definition from here. From here. So
Okay, ma'am. Okay.
after that, either say this or say this. Whatever
Okay.
you're comfortable with. Start again. Restart.
Yeah, got it. Okay, Sarah. Okay, Sarah, let me explain it to you in detail. So this is an autoimmune condition which affects our own immune system, which attacks its own tissues and organs, results in the inflammation that attacks its own tissues and organs, which affects the lungs, skin, heart, and then nerves.
And tiny lumps. This is very important because it forms
Okay,
granulomas,
and
no?
tiny lumps. Okay.
Tiny lumps are very important.
Yeah.
Okay. Then again.
Tiny lumps. So most of the times there were this one, ma'am, again. Yeah.
No, you have to
Most of the
complete.
times there won't. Yeah. Most of the times there won't be any reason why this is happening. But for few people it go away without any treatment. However, in some it may result in serious long-term conditions. More commonly, it affects 20 to 40 years age group people. It is not an inherited condition, but it can occur in our family members, and it is not infectious but can be passed from person to person. It may be related to some and it is also more common in the women and in Black African origin people.
Okay. And you have to also mention, though the cause is not known, but maybe some infectious environmental genetic factor may be responsible.
Yeah,
Say
yeah.
it is not directly inherited. That not directly inherited means you do not have any pedigree for this. Okay. It is like
okay,
diabetes.
not directly
Like
inherited.
diabetes.
Yes,
It is like multiple sclerosis.
Yeah.
One more volunteer, please.
Okay.
One more.
Ma'am, can I try?
Yeah, please.
Ma'am, can I try?
Yes, please.
So sarcoidosis, ma'am.
Yeah, please go ahead.
Hello?
Fast. Yeah. Anyone.
Yeah. Okay. Okay. So sarcoidosis is an autoimmune condition, which means that our own body cells are fighting against our own body. So what happens is there will be inflammation which causes small lumps in our body, which can affect mainly the skin, then the heart, lungs, and also the nerves. And usually we don't know why this happens. Sometimes some infection or some genetic causes or some environmental causes can trigger our own body's immune system to start attacking our own cells. And this is not this does not have like any genetic, it's not from our genes, and also it won't pass from person to person. But sometimes we found that people in the same family can have this sarcoidosis. And also um, this uh, yeah, I think that's all, ma'am. I don't know where I got a thought block in between.
No, it's okay, it's okay. It is an autoimmune condition where our own defensive mechanism starts attacking our own cells and tissues, organs, results in swelling that can cause clustering of cells and formation of tiny lumps in various sites within your body. Most commonly affects lungs, but can also affect skin, heart, and nerve. I repeat, it is an autoimmune condition where our own defense mechanism starts attacking our own tissues and organs, resulting in swelling that can cause tiny clusters of cell and formation of tiny lumps various size in your body. Most commonly, it affects lungs, but may also affect skin, heart, and nerves. Exact cause is not known, but some infectious environmental genetic factors may be responsible. It can occur in family members, but it is not a directly inherited condition. Few people may go away without any treatment, that is almost 6 out of 10, though some people may have serious long-term condition needing proper treatment. It is more commonly seen in Black, African, and in women between the age of 20 to 40 years. Clear? Now, obviously, so it is how I explained you earlier, how to go about the second part of task. BBN, we have done. Investigation not given so far. Explanation of diagnosis and causative and risk factor. We have covered this much, right? We have explained diagnosis. We have explained causative or risk factor of diagnosis, right? Now, fifth point is implication of diagnosis. So what is going to be that? So there will be three
Effect of disease on pregnancy.
Yes. Effect on condition, effect on mother, effect on baby. These are the three implications. This is why she has come here. She has come here to understand these three things only. That how it is going to deteriorate my condition, how it is going to affect my pregnancy and my baby, and how you are going to manage it. So these three are implication of. There is no infection given as such, Seema. I tried to search a lot, but there is no infection given. It is only written everywhere some infectious factor. I tried to find out, I couldn't find it. Effect on condition. Majority improvement in condition because of altered and suppressed immune responses. Why improvement? Because altered and suppressed immune responses. That T1 cell get suppressed in pregnancy. That's why there is improvement in condition. But you do not need to remember this one. This is just for explanation that T1 get depressed. So majority improvement in condition. Why? Because of altered and suppressed immune responses. No change in progression during pregnancy. It means it is not going to get worse during pregnancy. There may be an increased risk of immediate postpartum flare-up, lung or heart failure, especially if it is an active condition, need of hospitalization, increased demand of oxygen, and the development of high blood pressure in the blood vessels which supply lungs, especially if there is involvement of lungs severely. So this is effect on condition. Who is going to tell me properly as you are presenting to a role player?
I'll try, ma'am.
Yeah.
Coming to effect of condition on pregnancy, majority of the patients,
It is not effect
improvement in
of
the
condition on
condition
pregnancy.
because of
No, no, no.
altered and suppressed
Dear,
immunity
listen
in
to me.
in
Listen.
pregnancy, and there may not be any.
This is effect of pregnancy on condition. This is effect of pregnancy or condition.
Yes, ma'am.
Okay.
Okay. Majority improvement in condition because of altered and suppressed immune responses. There is no change in progression during pregnancy. There is increased risk of immediate postpartum flare-up, and there may be lung or heart failure, hospitalization, increased demand of oxygen, especially severe interstitial lung disease.
Increased demand of oxygen and increased blood pressure in the blood supplies of lung, especially if severely involved lungs. Okay. This doesn't happen in all the patients.
Okay.
Now, effect on mother. It's very easy. Who is going to read this for me? Who is going to read this?
Preeclampsia, high blood pressure.
No. How you are going to say it in layman language? You are explaining it to patient, no?
Okay. Yeah, okay. So there can be some effects on the mom as well as on the baby. So the effects on the mom will be like you can develop high blood pressure with some proteins in the V, blood clots in legs and lungs. And we will aim for a vaginal delivery, but there is a high
Don't say
chance
aim for
that
vaginal
you
delivery.
may
No.
end up having
Aarti. Do not say that we will aim for vaginal delivery.
Yeah,
It will not come here. Simply say what complications she can have. Aarti, you will say that it may have some effect on mom and baby.
Hello, ma'am.
It can cause high blood pressure.
Yes, ma'am.
In urine, blood clots in legs.
Yeah.
There
There
may
will be some
effect
on the mother.
Your voice is breaking. Your voice is breaking, Gayatri. Try.
Yes, ma'am. The range is not very good.
Yeah.
Ma'am, hello?
Yeah. Fast, Aarti, we have
there
to.
There can be risk of
What?
there can be risk of emergency section. And
Gayatri, you try.
hello, ma'am.
Aarti, you just check your network because it is really, we are not able to hear you. It is like too much of breaking in your voice.
Okay, ma'am.
Okay. Gayatri, try.
There are certain effects of sarcoidosis on the mother. Some women are seen to have preeclampsia, that is high blood pressure with protein in their urine, may have blood clots in their legs and lungs. There could be a requirement of emergency cesarean section or instrumental delivery. And after birth, there could be chances of postpartum hemorrhage, and very rarely there could be even death of the mother.
Post-delivery, there may be a risk of heavy bleeding. Postpartum hemorrhage, in layman language, you will say there may be a risk of bleeding post-delivery. Okay, this is how you are going to say that effect on mother. Sarcoidosis can show some effect on mother, like developing high blood pressure with protein in urine. There may be blood clots like the lungs. There may be need of emergency cesarean or applying instruments for delivery. High risk of bleeding after delivery. Rarely, death can also occur. I don't mean to scare you, because you are talking about that, but I have to be honest about the facts, and we are all there to support you. Clear? Second part, now effect on baby, it is very simple. Only two effects you normally notice, that baby, small size baby, and delivery before time. Fortunately, it doesn't cause miscarriage or early pregnancy loss or stillbirth, though if it is a very active stage and involvement of heart, there is a risk of fetal death. Mother death and fetal death more common if there is involvement of heart, right? So a patient is coming with some heart condition or MRI is showing there's some involvement of heart, then definitely on effect on baby, you are going to discuss about fetal death and you will speak about maternal death more clearly, because cause of death is normally when there is involvement of cardiac disease. When there is involvement of lung, it can be a difficult disease to cope up with, but deaths are very common when there is involvement of heart. Am I clear about this? I want two-way interactions because otherwise it becomes very boring for me that speaking and nobody is responding.
Yes, ma'am, clear.
Yes, ma'am.
Clear.
So this is how you are going to explain diagnosis, positive factor of diagnosis, then how it affects condition, how it affects mother, and how it affects baby. I repeat, when there is involvement of cardiac condition, then it becomes more deadly condition. There is more risk of fetal death. There is more risk of maternal death when there is cardiac involvement. Now, second part of the task, definitely, as I explained you, it's BBN, it's investigation, it's diagnosis, causative factor, implication. Immediately after that, you are going to talk about expert team, that you will be under care of expert team. Consultant, obstetrician, or pregnancy, or my consultant, whatever. Sarcoidosis team, including specialist doctor, nurse, and midwife. Whenever there is a team of a particular condition in pregnancy, we have three components: doctor, nurse, and midwife, because it is a pregnancy. And they do have specialists, these three, for almost all condition in UK. Blood doctor, baby doctor, sleep doctor will be included later on. Counselors, but of course, because this is going to affect her mental health, GP, eye, lung, brain, doctors, if needed. Clear? It is easy. Very easy, MDT. Now, listen to me carefully. You will be seen in consultant unit. A personalized care plan will be given to you. You will be taken care as high-risk pregnancy. Every visit you will be seen by joint team, that is consultant, pregnancy, and sarcoidosis team. There will be frequent visit. We'll put you on folic acid, which will continue till 12 weeks. I have given this task that patient has come with this medication as a theoprene. So now she has this concern as well, which she will set in agenda. Gayatri, she'll speak about this in agenda, that I am on certain medication. I'm really concerned whether it is going to be safe for my baby. As far as azathioprine is concerned, safe in pregnancy and breastfeeding, still we would immediately refer you to sarcoidosis team. Paracetamol we use as pain relief, which is considered safe. Steroid if condition affecting nerves, eyes, heart, breathing shoes. Steroid drops or ointment for eyes. So to manage flares in high doses, once controlled, then low maintenance doses, but this may increase risk of cleft palate in baby and high sugar in mom. Normally, we give prednisolone. Clear? Not clear?
Yes, yes, ma'am, clear.
Baby dose of aspirin and blood thinner injection after discussing with blood doctor. I always prefer that first you discuss about all drugs, then you discuss about all investigation, then you discuss about examination, so you do not miss. But if you want to explain trimester wise, that is also fine. But my personal preference is this. In investigation, definitely routine, that blood booking blood test, scan, Down syndrome, 20 weeks scan, this you will speak. But serial ultrasound for growth monitoring, as baby has risk of growth retardation. In case of feeling own heartbeat or rapid heartbeat, thyroid test, heart racing, whatever is given in bracket, that is for your understanding. Otherwise, what you need to speak, that is without bracket. In case of feeling own heartbeat or rapid heartbeat, thyroid test, heart racing, spatial imaging of heart, sorry, this echo. We offer echo. We do not offer cardiac MRI. Cardiac MRI only if condition is really deteriorating a lot. So that is ultrasound of heart. Or a special test that is 24-hour Holter monitoring. GTT at 24 to 26 if on steroid. In each visit, blood pressure, urine for protein and blood. Why blood? Because she would be at risk of kidney stone and other kidney pathology as well. This is very important. Remember this carefully. This is something different in this task. That from 24 weeks fortnightly and from 32 weeks, we do this every week. That is blood pressure, urine for blood and protein from 24 weeks to fortnightly and then from 32 weeks weekly. 28 weeks MDT to decide when, where, how to deliver. Patient's wish always taken in consideration. Again, very important differentiating point in this task is early delivery if severe active condition requiring aggressive medical therapy. These two are different than the routine. So in examination, we will talk about this much. So who is going to start with second part of the task from MDT? Fast. Or I'll move on. If no volunteer within 2 seconds, I'll move on. Okay, no one?
Shall I, ma'am?
Yeah, please.
Multidisciplinary team unit where you'll be seen by consultant obstetrician,
Never say
sarcoidosis,
multidisciplinary team, say expert team.
specialist doctor.
A jargon.
Okay. Specialist doctor team includes consultant obstetrician, sarcoidosis team, including specialist doctor, nurse and midwife, blood doctor, baby doctor, sleep doctor, counselors, GP, eye, lung, or brain doctors if needed.
Further?
You'll be seen in a consultant-led unit as it is a high-risk pregnancy, and a personalized care plan will be given to you, which includes a joint team, and you will have to make more visits. We'll be starting you on folic acid, and as far as the drug which you are taking, azathioprine, is considered, it is safe in pregnancy, so you can still continue that, and we would immediately refer if there is any risk to you, and paracetamol will be giving for pain relief. And steroid if the condition affecting the nerves, eyes, heart, or breathing issues are there. And steroid drops or ointment for eyes and to manage the flares. If given in high dosage, you will have to, you may develop, baby may develop cleft palate, and there can be risk of increased sugar in the mother. And we'll be starting you on low dose, baby dose of aspirin, and you will be put on blood thinners. And regarding the investigations, you will have to undergo serial ultrasound scan as there is a risk of growth restriction in the baby. And in case of, if you are feeling your own heartbeat, that's called palpitation or rapid heartbeat, we will be doing thyroid test, ECG or heart tracing, and a special heart scan called echo. And a special test, 24-hour monitoring of the heart will be done. and we'll be we'll be doing GTT or sugar test at 24 to 26 weeks if you are on steroids. And coming to examination, we'll be regularly checking your blood pressure and presence of protein in the urine at each visit. And from 24 weeks onwards, we'll be doing it once in 2 weeks, fortnightly. From 32 weeks onwards, every week we'll be doing. And at 28 weeks, you'll be seen by the specialist team to decide where and when and how to deliver you. And we'll be respecting your wishes. Always we'll consider patient's wishes first. And early delivery may be required if there is severe active condition and it requires aggressive medical therapy.
One more voluntary. It's always Nagarthan who is presenting. Nobody else is presenting. It is like written in front of you, dears. It will help you in remembering the things. Yeah,
can I try?
Yeah, it's Gayatri and Simab. So Simab, after that Gayatri, and I want very, organized presentation as you are presenting to a role player. Start, Simab.
Let me reassure you, your care will be under specialist team of doctors, my consultant, and special sarcoidosis team doctors, and also nurses, midwife, blood doctor, baby doctor, sleep doctor, the counselors, the GP, and if need arise, the eye, lung, and brain doctor may be involved. So you will, from now onwards, you may need to visit more frequently as this is a high-risk pregnancy. So your care will be under consultant-led unit. And as far as azathioprine is concerned, let me reassure you it's a safe in pregnancy. And for the pain relief, you can take paracetamol. And the steroids may need, the need of the steroid may arise later on if any eyes, heart, or breathing or nerves involved. We may give in the form of drops or ointment for eyes. And to manage flare in the high doses, agency is needed first. And later on, if disease is controlled, we shift to the maintenance dose. However, this may increase the risk of cleft palate in the baby and also risk of high sugar in the mom. Am I clear so far? So regarding your the examination, at every visit, we will measure your blood pressure and also proteins. From 24 weeks onward, we will measure to weekly basis, and then from 32 on the weekly basis.
Lovely. Very nice, very nice, Shima. It was so cool and calm. You were presenting so calmly. So cool. You're looking so, you are appearing a very confident doctor. Keep it up. It was really nice. Gayatri, are you there?
Yes, ma'am.
Okay. Now again, Shimab has raised the bar.
So,
Yeah,
okay.
So you will be led by a group of specialists consisting of the consultant obstetrician, sarcoidosis team, including the specialist doctor, nurse, midwife, the GP, the counselors, the sleep doctor, baby doctor, and blood doctor, and also the lung or the brain doctors if needed. Since you are a high risk pregnancy, so you will be handled by a consultant led in our consultant led unit, and will have to a personalized review plan would be made appropriate for you. You will need to come for frequent visits and will be taken care of by a shared care team, as well as you will be started on folic acid until 12 weeks of pregnancy after. And since you are using azathioprine, it is safe in pregnancy. However, for further review, I will be putting you in touch with the sarcoidosis team, and you can continue with your paracetamol for pain relief. And in cases, there could be a possibility that you might have flares in your pregnancy affecting your eyes, heart, and you might have breathing issues, for which steroid ointments or drops may be required. And in such cases, when given in high doses, there is a probability that the chance of cleft palate in your baby might be there, and you may have high sugar levels. Since your baby has a high chance of its growth getting affected, you will have to come for frequent growth scans, and it would be monitored. It will be monitored frequently, and also an echo, a heart scan would be required for your baby as well. And moreover, regarding the investigations, it is required to check your blood pressure and proteins in urine as well as blood tests in your every visits, as well as every every fortnightly it will be checked until 32 weeks of gestation, and then weekly after that. And at around 28 weeks, the team will be deciding regarding your mode of delivery, and your wishes will also be taken into consideration. However, if there is a severity in your case, there could be a requirement of your early delivery. I think I missed a few points.
Your investigation, you also mentioned that will offer you some booking blood tests and scan.
Oh,
Then
baby,
after this Down syndrome screening at 20 weeks, head to toe scan to rule out any abnormality in the baby. Serial growth scanning for the growth monitoring, as there is a risk of growth retardation or the small size baby. In case of feeling your own heartbeat or rapid heartbeat, we may offer you thyroid test, heart racing, or ultrasound of heart, or sometimes a special test that is 24-hour all the monitoring. GPP, as there is a risk of high sugar in case of steroid, we will be offering you between 24 to 26 or 28 weeks, right?
Yes,
and as far as examination is concerned, in every visit, we are going to check you for blood pressure, urine, protein, and blood. From 24 weeks onwards, it is going to be 2 weekly, and from 32 weeks onwards, it is going to be weekly. 28 weeks, expert team, including pregnancy doctor, baby doctor, sleep doctor, and sarcoidosis team will decide when, where, how to deliver. Your wish will be taken under consideration. We may offer you early delivery if severe active condition may needing any aggressive medical therapy. Am I clear so far?
Yes.
You have to be this much fast and clear. Well done, both of you, all of you, Nagaratan and Shina Benvo. Now the second part of class. We will plan your delivery in a consult-led unit. You will be given one-to-one midwifery care, continuous fetal heart monitoring. We'll aim for vaginal delivery. Aarti, this will come here. Okay?
Okay, ma'am.
We'll aim for vaginal delivery unless if there is any heart or lung involvement or worsening of condition. Whatever is in bracket, that is for understanding. So it is okay. So unless heart or lung involvement or worsening of condition, then we may offer you shortening of second stage by applying instrument or offering cesarean section. We may offer you hydrocortisone, a kind of steroid, a type of steroid to avoid stress level if steroid during pregnancy for longer period. In case of severe lung or nerve involvement, heart failure, this and if patient is with heart failure, your delivery will be in a tertiary care hospital under the care of expert team and personalized delivery plan. In case of severe lung, nerve, and heart failure, expert team, tertiary care, and personalized labor plan. In few neurosarcoidosis, this is very important. If any investigation being provided to you, if the suppose patient has come saying 32, 36 weeks, right? And patient has come with some investigation which is showing the involvement of brain and increased intracranial pressure. Vaginal delivery is contraindicated. It's not necessarily that patient is going to come at 7 weeks. Patient may come even at 20 weeks, at 32 weeks, 34 weeks. Or probably patient is admitted with labor pain and reports have been provided to you, which is showing that brain is involved and there is increased intracranial pressure. Immediately, you will counsel her against vaginal delivery. So you have to remember every point. Whatever is tasked, you should know the answer. If patient is coming that now the current this chest X-ray is being performed and CT scan or MRI, whatever. Normally we do not offer CT scan during pregnancy. That patient has come with MRI lung and the some lung spirometry and the chest X-ray. Chest X-ray is considered safe in pregnancy, and it is showing severe lung involvement. Then you will immediately say that expert team is going to be there for your delivery, tertiary care, and personalized care plan. where there may be a use of instrument to cut short second stage or cesarean section will be decided by MDT. If patient has come with clear-cut brain involvement and increased intracranial pressure, you are going to counsel against vaginal delivery. Same, if patient is coming with this severe lung involvement, that is ILD, maintaining oxygen saturation, careful fluid management to avoid the risk of heart failure, that is peri or postpartum heart failure. If you remember, in postpartum cardiomyopathy, there is one risk factor is autoimmune condition. Do you remember, guys?
Yes, ma'am.
So this is what it is. Now, who is going to Geeta? Geeta wants to present. Okay, Geeta, now you will present from interpartum. I think antepartum is clear to everyone.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Now Geeta wants to present. So Geeta present from interpartum. And you
Okay,
are
ma'am.
presenting to a role player, so your language has to be that way. No jargons.
Okay, ma'am. Okay. Okay, so Sarah, your delivery will be to reduce all these, to minimize all these complications. Your delivery will be at the consultant-led unit. We will offer you one-to-one care. Your baby heartbeat will be monitored by a CTG, a machine. Our aim will be to deliver you vaginally. But in the case when there is the heart or the lungs involvement, or when there is a worsening of your condition, in that case, we may need to deliver you early by some instrument or may require the cesarean section. Okay, am I clear up to this point, Sarah? Okay, so Sarah, we will offer you, if we keep you on some medications, steroids. In that case, we will offer you hydrocortisone at the time of the labor to prevent stress labor. And in case we find out that there is a lung involvement or the nerve involvement, in that case, your care, your delivery will be at the tertiary care, and your care will be the personalized care. Okay, and in the case,
under
yeah,
expertise.
Yes, under expert team. And in the case, Sarah, if we found out that there's a nerve involvement and there are high pressures in the brain, in that case, vaginal delivery would not be a safe option for you. In that case, we may need to offer you the cesarean section. While in the labor, Sarah, if we find out that there is the lung involvement, and in that case, we will monitor your amount of the oxygen in the blood, as well as we will give you fluid very cautiously to prevent the heart failure.
Lovely.
I'm sorry.
Well done. Well done. Well done. Very good. Very good. Who wants to repeat it? Geeta has really presented it nicely. Very confidently. Well done.
Thank you, ma'am.
Who wants to present this now? Come on, guys. Fast. I'm hungry. Then I'll become angry. No one? No one? I think I should wind up. Okay?
No, ma'am.
Let's see. The rest you study yourself. Okay?
No, ma'am. No, ma'am.
Then?
No, ma'am, I
saying
will
no, ma'am?
try.
Who was saying no, ma'am? Who was saying
Ma'am, I will.
Who was?
Ma'am,
Who
I
was?
will.
Who was saying? Who was saying no, ma'am? Who was saying no, ma'am?
Ma'am, I said.
Who? Aarti?
Gayatri. Gayatri.
Gayatri, then now it's your job to present it. Because you said.
Okay.
And I want the way Geeta has presented. Geeta has really presented it nicely. I'm impressed. Yeah.
During labor, your further management would be led in a consultant-led unit, and you will be taken care of on a one-to-one basis, and your monitoring would be done for your baby and you with the help of a machine known as CTG, and we will be aiming for a vaginal delivery unless the heart or the lung involvement occurs, and in such cases there might be a need to use instrumental delivery, or we may have to go for cesarean section. In order to avoid stress during the labor, we may also offer you with steroids like hydrocortisone. Am I clear so far? In case of having severe lung or nerve involvement, and or heart failure, we will be requiring you to be delivered in a tertiary care unit under with the help of specialist doctors. Am I clear? I got disconnected.
Yeah, there's one more slide. Gayatri? I think she's in hospital, no? So somebody has called her. Who wants to read this this last slide? Proper way? Come on, fast, guys.
Ma'am, I will try.
Yeah, please.
Okay, so in some cases of sarcoidosis, like if your brain or nerves is involved, which can lead to increased pressure in your brain, in that case, we won't recommend vaginal delivery. And also, we need to make sure that your oxygen in your blood is maintaining good. And also, we have to very carefully give fluids because that can, there's a risk of development of heart failure either around during delivery or after delivery. So, because of all these reasons, a team of expert doctors and you will be delivering in a consultant-led unit.
Lovely. Baby handed over to baby doctor, early breastfeeding, mobilization, early drinking, eating and drinking, DVT assessment, and need of like compression stocking or that pump or injection as per blood doctor suggestion. Continuation or restarting of medical therapy as early as possible. So early follow-up with medical team. After delivery, there is early follow-up with there will be early follow-up with the medical team for continuation or restarting the medical therapy. Contraception, keeping maternal risk and accounting the maternal consequences due to condition. Like if patient develop pre-eclampsia, then we have to avoid oral contraceptive pills that way. So no need to say in detail, just say contraception. Yes, Simam, you can discuss about PPH as well when you will discuss intrapartum hemorrhage, that we'll do the active management of your labor after delivery of placenta or after birth, and we may need to give some extra medication or surgical procedure. Okay, Shana? If you get this
Okay, ma'am, and
right,
argometrine should be avoided, right? Argometrine, because patient might have blood pressure and all.
definitely in pre-eclampsia patient, we never give argometrine.
Yeah, we
If
don't
you
give
have
it.
that much time, you can definitely address that.
Okay, thank you, ma'am.
Now, this is very important. Probably this patient or this task may come as preconception counseling. Preconception counseling involves a lot of things in sarcoidosis. Healthy life, healthy diet, regular exercise, adequate sleep, because stress, lack of sleep can be a predisposing factor for worsening of conditions. So adequate sleep, adequate rest is very important. Quit smoking, that also deteriorate. Healthy BMI. Folic acid, this is a patient safety point. If if patient is taking methotrexate and she has stopped methotrexate just 4 weeks within pregnancy, like within 4 weeks of pregnancy, then we have to give folic acid 5 mg. That is the only condition where you have to give folic acid 5 mg in sarcoidosis. Otherwise, it is 4 mg. So who is going to repeat this sentence? Because this is patient safety. Because in SD, your examiner can ask this question. Repeat this, 2 or 3 girls, repeat this. Repeat.
Yes, ma'am. I'll
Repeat.
folic acid 5 mg should be taken if your pregnancy is within 4 weeks of stopping methotrexate.
Who else wants to repeat this?
Folic acid 5 milligram should be started if you are becoming pregnant within 4 weeks of stopping methotrexate.
One more. One more. So you will never forget this.
Yes, ma'am.
Yeah.
Folic acid 5 milligram in a pregnancy within 4 weeks of stopping methotrexate.
optimization of condition and optimization of medical management. We do both in preconception counseling in sarcoidosis. Optimization of condition, how you do it? All investigations as heart racing, scan of heart, how liver and kidney functioning, checking the blood strength and blood sticking power. The level of this is very important. What is this ACE?
Angiotensin converting enzyme.
Yes. We check level of this. Why? Because in sarcoidosis, this level increases. But this is only important in preconception counseling, not in pregnancy, because in pregnancy, because of dilution, it decreases. To check the level of or activity level of disease, ACE level is always checked in preconception counseling. It can be a very important question in SD. Lung functions if symptoms of lung involvement. So this is how we do optimization of condition before planning pregnancy, that all investigation like heart racing, scan, how kidney liver functioning, blood strength, what is the level of this particular enzyme, lung functions if there are symptoms of lung involvement. Optimization of medical management by stopping or shifting to pregnancy safe drug by expert team. This is, you have to speak in preconception counseling. Who is going to repeat this for me fast?
Yes, ma'am. So optimization of condition includes all investigations as ECG, echo, liver function test, kidney function test, full blood count, AC level, lung functions if symptoms of lung involvement, and optimization of medical management by stopping and shifting your pregnancy to the safe drugs by your specialist doctors.
Clear, everyone?
Yes, ma'am.
Yes, ma'am.
Yeah, ma'am.
This is patient safety point. This can be a very important point in SD. Or probably patient will come with like patient has just stopped methotrexate. Probably it would be like that. Just say that, okay, patient had her last period, say 5 weeks back, right? And she had unprotected intercourse, say 2 weeks after her period. Okay. She was somewhere aware that methotrexate cannot be taken during pregnancy, so she stopped there. And she now missed her period. So she missed her period within 3 weeks of stopping methotrexate. If she has come with this condition or this task, then this is going to be a very important patient safety point. Am I clear? So these are very important small points which you have to remember while you are reading tasks. Sometimes you may get tasks of 2 pages, 3 pages. I have seen that, again, I'm sorry I'm mentioning that. Few mentors say that just read between the lines. Just read one word. No. Don't do this. Because in the end, they may give you this one line that she had just stopped her methotrexate 3 weeks back. One line at the end. And probably you have missed that line. And you are missing complete task now. Am I clear, girls? Read your task completely properly. Because now college is becoming very smart. They are giving, they are picking from any line, any point. And in good 3-4 pages, one single line, and which is going to change completely approaching task. Clear, girls? And boys, if anybody there? Am I clear so far?
Yes, ma'am, clear.
Yes, sir.
Okay. Now, disease modifying drugs. Same like multiple sclerosis, we also offer disease. See, most of that autoimmune condition, we need to offer disease modifying drugs. So, here we offer disease modifying drugs. This is for your ST. Now, who is going to read this for me? This is very simple, actually.
I'll read, ma'am.
Yeah, please.
Azathioprine is safe in pregnancy and breastfeeding.
This is brand name. This is brand name. Now they have started giving brand name rather than giving salt name. So you have to remember brand name as well of most of the drugs, especially if disease modifying drugs. Okay, go ahead.
Azathioprine is Imran. It is safe in pregnancy and breastfeeding. No structural defects in baby or miscarriage. Birth weight is normal. If methotrexate, it is not safe in pregnancy and breastfeeding. It is a non-teratogenic drug, causes miscarriage and fetal structural defects. It should stop 4 weeks prior to conception and 5 mg folic acid if stopped within 4 weeks up to 12 weeks of pregnancy.
One more volunteer, please.
Yes, ma'am, I will try. So azathioprine, Imuran, this drug is safe in pregnancy and also during breastfeeding, and there is no evidence that it will cause any miscarriage or any structural defects to baby, and also the birth weight is also not affected. Methotrexate, this is not a safe medicine because it can be teratogenic to the baby, which means that it can cause fetal abnormalities and also miscarriage, and this medicine should ideally be stopped 4 weeks before trying for a baby. And if you become pregnant within 4 weeks of stopping methotrexate, we will advise to take 5 milligram folic acid up to 12 weeks of pregnancy.
Clear, girls?
Yes, ma'am.
Birth
Yes,
defect.
ma'am.
If it is like this thing, then it is birth defects. Okay. Even this medicine or drug is safe, still you are going to refer her to sarcoidosis team immediately once she confirms her pregnancy, because she may need any change in doses. Remember that. Though you will counsel her, this is safe. It is not going to cause any birth defects. It is not going to cause early pregnancy loss. It is not going to affect baby's weight or size. Still, we are going to refer you to sarcoidosis team for the management or for any optimization of drug. You have to mention this and you have to refer. Now, who is going to read this? Micropheno. Who wants to read this?
Ma'am, I will read.
Anybody else? Is only Divya and Nagaratan and Geeta and sometimes Gayatri who are attentive and presenting. Nobody else is attentive. Now I'll pick up the name. Either you leave class or you have to say. I'll pick up the name now. Be ready.
Sorry, ma'am. Sorry, I was with the patients. I'm so sorry for that.
Okay. So Geeta, Gayatri, Manikam, Shelly, Shaista.
Yes, ma'am.
Yeah, read.
Regarding the Moftil, that is the mycophenolate, this is not safe in pregnancy. We have to stop this medicine at least 6 weeks prior to conception, because it is not baby friendly. It causes early pregnancy loss. Baby can be small in growth. Baby can be having some structural defects like abnormal outer ear, some facial clefts, and baby can be having smaller lower jaw. So
Okay.
it should be avoided.
It's avoidable. What if it comes as SD? Now, how you are going to present this to your examiner? Who was next? Who was next? Fast, guys, fast.
Ma'am, I will try.
Shelly, unmute yourself.
Yes, ma'am, I'm here.
Okay. Now you are presenting this paragraph to your examiner in SD. How you will present it?
Regarding this drug, which is mycophenolate mofetil, it is not safe in pregnancy, not baby friendly, and not safe in
You are
breastfeeding.
presenting to examiner. Are you saying it baby friendly?
Okay. To the examiner. Structure discussion. Okay.
Yes.
So this is regarding the drugs, the mycophenolate mofetil. It is not safe in pregnancy and not safe in breastfeeding. It causes some complications like micro miscarriages, small for gestational age, and fetal structural defects like
Microtia.
microtia abnormal. Yes,
Microtia. You will just
Yes.
mention the name. You will not explain. Microtia.
Yes, and micrognathia.
And facial.
So because of that, it should be stopped about 6 weeks prior to the conception.
Now, Divya, you have to present these 2 slides to your examiner in SD.
Yes, ma'am. So, yeah, the drug azathioprine and methotrexate. Azathioprine is trade name is Imuran. It is a safe in pregnancy and breastfeeding, which don't have any structural defects in the baby, and the birth weight is also normal. Coming to the methotrexate, it is not safe in pregnancy and breastfeeding, and it is a teratogenic drug which causes miscarriage and fetal structural defects. It should stop 4 weeks prior to the pregnancy, and 5 mg folic acid should be stopped within 4 weeks and start within after and continue till 12 weeks of the pregnancy.
Next slide. This one.
Yeah, mycophenolate mofetil is also not safe in pregnancy and breastfeeding. It causes miscarriage, fetal growth restriction, and fetal structural defects like microtia, micrognathia, and it should stop 6 weeks prior to the conception.
Lovely. So this is if it comes in SD, then you have to mention all disease modifying drug, or if patient is taking any of these drugs, then how you have to address this. Now talk about this.
Leflunomide, the trade name is Arava. It is not safe in pregnancy. It is the 11 days is the washout period with the coletyramine washout procedure followed by fetal medicine referral and reproductive age switch to alternative drug.
Clear? This is also a disease modifying drug. Anybody else repeat it, because I don't think you have heard this name before.
Okay, ma'am, I will try. So leflunomide, also the trade name is Arava. This drug is also not safe in pregnancy. The 11 days washout period for this medicine, and also we can give a cholestyramine washout. And after this, we have to refer them to fetal medicine. And in reproductive age, we will switch to another alternative.
If patient is in reproductive age, so you will speak this in preconception counseling. If patient is in reproductive age, even not planning for pregnancy, we should always try to switch to a drug which is safe in pregnancy. Now,
okay,
who is going to speak about biologics?
May I, ma'am?
Yeah, please. Yeah, please go ahead.
Yeah. Biologics, they are third line alternative in disease remission in the pregnancy, no structural differences, no effect on pregnancy outcome. Adalimumab after 28 week we can give. Infliximab stop
we have to stop,
20
not
week.
give, we have to stop, sorry.
Okay. Infliximab we have to stop after the 20 week. And though both can continue on a risk-benefit ratio throughout the pregnancy, need to avoid live vaccine in the neonate for 6 months in view of immunosuppression because of these biologics.
One more volunteer to read this.
Can I read, ma'am?
Yeah, please.
Third line alternative in disease remission in pregnancy. No structural difference noted. No effect on pregnancy outcome. Adalimumab should be stopped after for 28 weeks, and infliximab should be stopped after 20 weeks. Though both can continue on a risk-benefit ratio throughout the pregnancy, but need to avoid live vaccine in neonates for 6 months in view of immunosuppression.
So this is if SPT comes or even SD, how you are going to address this. There is very good talk about sarcoidosis, where they have given how we do staging of pulmonary sarcoidosis, because if it comes as SD and your examiner asks how you are going to diagnose sarcoidosis. So you have to say that many patients may remain asymptomatic. Pulmonary involvement is the commonest presentation, that is more than 90%. Many patients may remain asymptomatic. Pulmonary involvement is most common presentation, that is more than 90%. And clinical presentation of sarcoidosis is dependent upon the site of presentation, obviously because it involves lungs, it involves nervous system, it involves skin, it involves eyes. So depending upon which particular system it is involved in, it will show the sign and symptom. Sign and symptoms we have discussed in detail in the beginning. If your examiner asks about what is the one condition which can occur because of the lung involvement where we cannot advise pregnancy, that is pulmonary hypertension. A significant set of patients with lung involvement may develop pulmonary hypertension before pregnancy. I repeat, a significant set of patients with lung involvement may develop pulmonary hypertension. In that case, we have to counsel them against pregnancy. So first, and the common involvement is pulmonary involvement. So if it is a SD, you are going to say clinical presentation depends upon the site of condition or site of sarcoidosis. Pulmonary presentation is the, or pulmonary involvement is the commonest one, that is more than 90%. In a subset of pulmonary involvement may develop pulmonary hypertension, so it is against conception. We cannot advise those patients for conception. Now, second is extra pulmonary involvement. Extra pulmonary involvement is most common is skin. So pulmonary and extra pulmonary. Extra pulmonary, what is the commonest one?
Skin. Skin.
Okay. And what other organs other than skin? Liver,
Heart and nerves,
Joints.
liver,
brain,
joint,
joints.
ear,
Clear? So the commonest is pulmonary, more than 90%. In subset, patient may develop pulmonary hypertension. We cannot advise for pregnancy. Extra pulmonary commonest is skin. Other than skin, you are all very well aware of this. 90%, more than 90% were having pulmonary. More than 50% will have cardiac. Up to around 50% will have cardiac symptom or cardiac involvement. So 90% pulmonary, extra pulmonary commonest is skin. Other you know, cardiac involvement is around 50. If infiltrative myocardial disease, then it can cause maternal and subsequent fetal death by causing life-threatening arrhythmia. Again, a very important question for SD. Central nervous system involvement is 5 to 13%. It most common sites, cranial nerves. So most common symptom, facial nerve palsy, optic nerve dysfunction, papilledema. Now we will repeat together. Commonest is
Pulmonary.
pulmonary. What is the percentage of prevalence?
More than
90.
90%.
What is the subset can develop where we cannot advise pregnancy?
Pulmonary hypertension.
Okay. What are the extra pulmonary symptoms or site?
The most common is skin.
heart,
Skin,
joints,
heart,
ears,
joints, eyes, ears.
eyes,
And most
kidney
common
stones.
extra pulmonary manifestation?
Skin.
Skin. And how much? What is the prevalence for cardiac symptoms?
50%.
What if it is having infiltrative myocardial disease? What is the outcome?
Maternal and fetal death.
Because of
Peripartum
life-threatening
cardiomyopathy.
life-threatening arrhythmias. Okay. And what is the prevalence of central nervous system involvement?
13%.
5 to 30%.
5 to 13%. 90, 50, 5 to 13. Or you remember in easy way, 90, 50, 5 to 50. Remember this. Okay. And what is the common site in the nervous system?
Cranial nerves.
Cranial. And what are the commonest symptoms?
Facial palsy.
Facial nerve palsy.
And three.
Optic.
Papilledema.
And optic nerve dysfunction. FOP. याद रखो FOP. 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 Facial nerve, optic nerve, papilledema. FOP. CNS is for FOP.
Okay.
Clear? So this
Yes,
is
yes.
how you have to present if it comes as SD when your examiner asks about the clinical features. So first line would be clinical presentation of sarcoidosis is dependent on the site of presentation, which you understand, no? It's not something the rocket science in this. Now, if your examiner asks how you are going to stage severity of pulmonary sarcoidosis, anybody? How you stage severity of pulmonary sarcoidosis? We call it as Scadding staging. That is SCADDING. It is given in talk and it is also I posted in flowchart. There are 5 staging. Stage 0 is normal but obvious. Stage 1, you start thinking that what is the most distant part of lung? That is hilar, right? Bilateral hilar adenopathy. Second stage, hilar adenopathy with pulmonary infiltration. Now from hilum, disease is going inside lungs, right? So this is hilar adenopathy with pulmonary infiltration. Now third is pulmonary infiltration without adenopathy. So stage 2 and stage 3 are both, one is going on north, one is going on south. So stage 2 is hilar adenopathy with pulmonary infiltration. Stage 3, pulmonary infiltration is there, but there is no adenopathy. Last is pulmonary fibrosis. This is the most dreadful stage of pulmonary sarcoidosis because once pulmonary fibrosis, there is reduced function of lungs. So now, what is the staging system for pulmonary sarcoidosis to stage the severity? What is
Shedding. Shedding.
What is the name of staging?
Shedding.
How do you spell it?
SCADDING.
Shedding system. Now, what is the stage 0?
Normal. Normal.
One, now start thinking stage 0, both lungs, hilum, everything is fine. Now stage 1, start
Hilar
lymphadenopathy.
and stage 2, now it is going in
hilar lymphadenopathy with pulmonary infiltration.
Okay, and stage 3 is little bit different. Stage 3 is little bit odd. It has infiltration, but it doesn't have adenopathy. Otherwise, it was going in a pretty sequence. Hilar adenopathy, then hilar adenopathy and pulmonary infiltration. Then third should be something more, but third is little bit different. So it has pulmonary infiltration, but it doesn't have adenopathy. And the last stage is pulmonary
fibrosis.
Okay. Now, symptoms. If like something systematic, it is going to be fever. Pulmonary, what are the symptoms in pulmonary involvement? Systemic
Breathlessness,
dry cough,
breathlessness and dry cough. Just remember
breathlessness.
two, more than enough. Cardiac involvement, what are the symptoms?
Irregular heartbeat.
Palpitation.
So will you say irregular heartbeat?
Tachycardia.
Your examiner?
Arrhythmia.
Arrhythmia. Syncope, arrhythmia, heart failure. And sudden cardiac death. That we have learned just now, no? That the most common cause of death is in sarcoidosis, heart infarction, cardiac, syncope, is arrhythmia, heart failure, and cardiac death. And skin, erythema nodosum and lupus pernio, subcutaneous nodule. 3. Erythema nodosum. What is erythema nodosum? Anyone know? Anyone knows?
There will be tender
rounded
red
lumps. The what we have learned the very first, tender lump. That rounded red tender lumps. That is, what is that? Erythema
Erythema
nodosum.
nodosum. Second is subcutaneous nodules. That is easy to remember. Third is lupus pernio. What is that? The second
is
what we
patches
read?
on
Second what we read?
granulomas.
Skin
patches on
rashes.
legs and arms.
Second we read skin rashes, right? We read two things, no? Tender lumps in upper body.
Granulomas.
Second,
Granulomas.
no. In the beginning of symptoms, what we learned? What 2 points? we
Tender
learned?
bumps. Tender
Tender
bumps
bumps
in the upper body
and patches on
and
the skin.
red, brown,
Tender bump.
Subcutaneous
and
bumps.
This is what? This is what is the
Erythema
medical
nodosum.
term?
Erythema nodosum.
And what is the medical term for this?
Lupus pernio.
Lupus
And-
pernio.
Yes. Okay. And what about eye? Eye.
Red eyes, conjunctivitis.
Papuloedema, red eyes.
Conjunctivitis
Conjunctivitis.
and conjunctival granulomas. Uveitis. You can also learn that. That is
Uveitis.
renal. One more question. Okay. Normally we offer vitamin D3. Do we offer vitamin D3 in this patient?
No, there is
Why not?
excess calcium.
Why not? Yeah.
There is excess calcium in here. Calcium deposits in renal
calcium and
calculi.
vitamin D based supplements to mitigate the risk of preeclampsia should be avoided. Normally, in case of preeclampsia, we prefer to give high doses of calcium, right? We prefer to give vitamin D3, right? Vitamin D3 even otherwise recommended in all pregnancies in UK. But here we do not give because abnormal calcium channel which occurs in this disease, very important patient safety point. If your patient asks why you are not putting me on vitamin D3 and calcium.
Ma'am, I didn't understand why we are not giving in sarcoidosis.
Anybody who wants to answer her?
Ma'am,
there is abnormal calcium deposits and also
normal calcium metabolism which occurs in disease.
And one more thing, ma'am, these patients are more prone to calcium renal stones. They are mostly calcium deposits.
Yes. That is why, because there is abnormal calcium metabolism. No, that's why it is causing renal stones. Clear?
Yes, ma'am.
So now in renal, what we'll say? Calcium deposition, renal stones, diabetes insipidus, if you can remember this, because this is easy to remember, and renal failure. Calcium deposition, renal stone, nephrogenic diabetes insipidus, and renal failure. Okay? Lymph, perineal lymphadenopathy, this we have already, and in endocrine, thyroid abnormalities, and central diabetes insipidus. So if it is renal involvement, then nephrogenic, endocrine, then central diabetes insipidus, and thyroid abnormality. We have learned, no? If patient is having arrhythmia, rapid, this and that, we offer thyroid blood test.
Yes.
In liver, there can be hepatomegaly, there can be granulomas. Okay. Neurological, cranial neuropathy, that is facial nerve palsy. If you remember this much, that is also fine. Musculoskeletal, skeletal, that bone pain, joint pain, or here you can say polyarthropathy. Arthropathy. And in electrolytes, hypercalcemia. So now, restart first. If your examiner asks about clinical feature of sarcoidosis, how you are going to start? I want chorus. Chorus, please. You understand chorus or no?
Ma'am, yes, ma'am, depending upon
start. Fast. I'm hungry. I have not had my lunch.
If lung is involved, then a dry cough, shortness of breath.
No. I'm asking if your your examiner asks, Dr. Shaista, can you tell me the clinical features of sarcoidosis? How you are going to start?
There will be tender bumps on the upper
Clinical
part of.
presentation of sarcoidosis. Please, girls, be active, be alert. Otherwise,
Yes,
I'll have arrhythmias now.
We'll be starting with erythema nodosum, subcutaneous nodules, and lupus pertineo. Then there could be dyspnea or
I would have
or
started this way because I'm presenting to a consultant that clinical presentation of sarcoidosis is dependent on the site of presentation.
site of the
At least I repeated this line 7-8 times. This is you have to signpost about clinical feature because it depends upon the site. No, it is not necessary that everybody is going to have lung involvement, brain involvement. And is that so, Gayatri?
no, ma'am.
You have to signpost. No, that doctor clinical presentation is depending upon the site of presentation.
Right.
Mostly patients are asymptomatic. That is your second line. Third, most common presentation is pulmonary. That is more than 90%. Then you will mention these sign and symptom. That is breathlessness and cough. That is persistent dry cough. After that, it is
heart.
There is a risk of pulmonary hypertension in subset of if there is interstitial lung involvement or lung disease, then we will counsel against pregnancy. The second is extra pulmonary presentation. The commonest is skin. Then in the skin, what are the symptoms and signs?
Erythema nodosum, subcutaneous nodules, and lupus pertineo.
Lovely. Then it may also involve joint, liver, skin, heart, brain. Now tell me 2 points for everything. For heart?
Arrhythmia, tachycardia, palpitation.
And heart failure.
Yes, syncope, arrhythmia, heart failure, sudden cardiac death. Then skin we have already spoken, no? Okay, liver? Granulomas. If you can't remember anything, just say granuloma. Okay, then in kidney?
Stones,
calculi,
stone, and
nephrogenic
diabetes insipidus. Lovely. Then lymph? Perineal lymphadenopathy.
Lymphadenopathy.
Yes. Eye?
Conjunctivitis, uveitis, or granulomas.
Enough. 2 are enough. 2 are more than enough. Endocrine?
Thyroid.
Central diabetes insipidus.
Central diabetes insipidus and thyroid.
Thyroid.
Okay. Now neurological.
Cranial nerve pulses, like
Remember two things. Cranial mononeuropathy, peripheral neuropathy. Cranial mono मतलब एक बार में only one nerve is involved. Only one cranial nerve at one time. Cranial monotherapy like facial nerve palsy. Second is peripheral neuropathy. What about musculoskeletal?
Polyarthritis.
And what will be the symptoms?
Joint pains.
Joint pain and bone pain. And what about electrolytes?
Hypercalcemia.
Why does it not offer this calcium and vitamin D3?
Deranged calcium metabolism.
Lovely. Now, what all investigation are you going to offer? This is your examiner going to ask. Or how you are going to diagnose sarcoidosis. Signposting. Diagnosis of sarcoidosis is predominantly one of exclusion. What is signposting? Diagnosis of
exclusion.
And what is the principle of diagnosis? 3 major criteria: clinical presentation, known caseating granulomas in tissue sample, and exclusion of other granulomatous disease. What are the, tell me one granulomatous disease?
Tuberculosis.
And that is caseating, non-caseating?
Caseating.
Lovely. So as an examiner, I'm asking how you are going to diagnose sarcoidosis. So what is going to be your signposting? First line.
Sarcoidosis is a diagnosis of exclusion.
And this is based on 3 major criteria. Criteria: clinical presentation and
Non-caseating granuloma.
tissue sample. Final diagnosis is always with tissue biopsy, just like molar pregnancy. Final diagnosis is always with tissue biopsy, just like molar pregnancy. So first is clinical presentation, second is non-caseating adenoma in tissue biopsy, and third, we have to rule out other granulomatous condition because this is a diagnosis of
Exclusion.
exclusion. Then just mention the name of investigation, chest radiograph, which will demonstrate bilateral hilar lymphadenopathy. We can offer CT scan. We can offer bronchoalveolar lavage, transbronchial biopsy, which is very important to confirm ILD. What is full form of ILD?
Interstitial lung disease.
And that is the most dangerous condition of pulmonary involvement in sarcoidosis. So what all investigation for pulmonary involvement? Chorus, please.
Chest X-ray.
Say chest radiograph. You are talking to a consultant. Chest radiograph. This is something simultaneous. You say this we can consider even in pregnancy. Okay. And second is CT.
CT.
Which normally we do not offer in pregnancy. Third, bronchoalveolar lavage. Fourth,
transbronchial biopsy.
Transbronchial biopsy. And then MRI. Okay? And very important, how we monitor disease in a non-pregnant patient. What if your examiner asks this question? Dr. Gayatri and Dr. Shaista, how you are going to monitor severity of this disease in a non-pregnant women? I want one test.
Yes, ma'am.
Lovely. Who said AC? AC.
Yes, ma'am.
Lovely. Remember, in non-pregnant patient, serum angiotensin converting enzyme level can be used for disease monitoring. However, this level can be altered in pregnancy, so we do not use this for monitoring in a pregnant patient. Clear?
Yes.
What about heart symptom? If somebody is having cardiac symptom, what all? ECG?
ECG, echo,
cardiac
MRI.
Cardiac MRI. Cardiac MRI is very helpful in pregnant patients. Do we offer contrast?
No.
In pregnancy? Which contrast we use in MRI?
Gadolinium.
Gadolinium. Gadolinium. Speak again, everyone. Which contrast?
Gadolinium.
Okay. So how you are going to talk about if patient, now your examiner is asking, Dr. Shelly, patient is having cardiac symptom, how you are going to investigate her?
ECG, echo and cardiac MRI.
And cardiac MRI, won't you like to give a little bit detailing?
Non-contrast.
Non-contrast cardiac MRI.
If it is pregnant, then it is going to be plain cardiac MRI. If it is non-pregnant, then it is going to be
contrast.
With contrast. But if we need to use contrast, then we have to analyze risk versus benefit. What about if somebody is coming with the neurological symptom or you are doubting neurosarcoidosis? What all investigation you are going to offer?
MRI we can offer.
MRI and EMG, that is electromyography, and CSF analysis. CSF analysis. We should ideally keep malignancy at differential diagnosis, okay, during pregnancy. So what is the right way to rule out? That is histopathological, which normally we avoid in pregnancy. So now how you are going to investigate everybody in chorus quick.
Investigations will
Signposting. What will be your signposting?
It's a multi-system disorder, depending
It
upon
is
which
a
system is
diagnosis of
by
exclusion.
exclusion.
Three major criteria: clinical presentation, non-caseating granuloma in tissue biopsy, and ruling out other granulomatous condition. These are the three criteria. For God's sake, I've repeated 3 times. What if any chest involvement or lung involvement, what all you are going to offer her? Just mention the name.
Chest radiograph, CT, MRI, bronchoalveolar lavage, and transbrachial bronchial biopsy.
Gayatri?
CT scan.
Chest radiograph, then second?
Sorry, chest radiograph, then CT scan, and then
bronchoalveolar lavage,
transbronchial
biopsy.
lavage, and then in transbronchial biopsy.
MRI?
And MRI.
And ACE levels. I would suggest note down. It will be very easy for all of you to revise it. First, write, if your examiner asks how you are going to investigate. Diagnosis of exclusion, 3 criteria. Write fast. 3 criteria: clinical presentation, non-caseating in tissue biopsy, and caseating, other caseate or other granulomatous condition. If chest symptoms, then chest radiograph, CT, bronchoalveolar lavage, transbronchial biopsy, MRI, ACE level. In bracket, ACE level is not recommended in pregnancy because it is altered because of dilution. Number 2, cardiac symptom. First, ECG. Second, echo. Third, cardiac MRI. Contrast only if non-pregnant. If pregnant, then analyze risk and benefit. Contrast it gadolinium based. If neurosarcoidosis, then brain MRI, CSF analysis, cerebrospinal fluid analysis, and EMG. That is electromyography. Just means you have to just mention the name. Your examiner will be more than happy. And last, we may need to keep differential diagnosis malignancy, which needs to rule out in a timely fashion during pregnancy. Histopathological confirmation or tissue biopsy is very important to rule out malignancy, but should be delayed until after pregnancy. So, first, introduction, you understand that it is an autoimmune disease of infectious, genetic. It is not a direct inherited. This is non-caseating granulomas. This is how you are going to introduce. Then your examiners are going to ask what are the clinical features. Then you have to, now you understood, right? Now third question can be investigation. Fourth question, effect on pregnancy, that you understood. Effect on condition, that you understood. Effect on baby, that you understood. Intrapartum care, that you understood. Antenatal care, that you also understood. Okay. Preconception counseling, that we have also discussed. And postpartum, that we also have discussed. Disease modifying drug, that we also discussed in detail. I don't think that any other question will come other than these all questions even in ST. If your consultant asks how you are going to assess this patient, whenever there is assessment, it means you have to take history, you have to do examination, and you have to perform investigation. Because without investigation and examination, you cannot assess any patient. So if he is asking about assessment, you will talk about all information gathering, where you are going to talk about if cardiac involvement, these are the symptoms. If pulmonary involvement, these are the symptoms. If eye involvement, these are the symptoms. Musculoskeletal, these are the involvements. Endocrine, these are the symptoms. Clear? Then after that, you are going to talk about examination. So general examination. General examination, definitely you are going to examine chest, you are going to examine cardiac, You are going to examine head to toe for skin for all kind of lumps. Right? After that investigation now you will present in a very nice way, I'm sure. That is pulmonary, if cardiac, if neuro, this. If other than that, you can also involve. If eye involvement, then ophthalmologist, orthopedician, if it is this. But even if you say these 3-4 major things like cardiac, pulmonary, neuro, you are going to pass this exam. Then rest, effect on pregnancy, this is modifying the. I think that's all for today. And I hope this was helpful for you. And I'll try to take these kind of talk which has not come in exam, and those are like quite recent. That's all. Bye-bye, goodbye. I will be waiting for your feedback about this in free group.
So much.
Okay.
Thank you.
So much, ma'am.
Thank you,
Thank
ma'am.
you.
Thank you so much, ma'am.